Hi, my name is Amanda. I'm an A&E paramedic and the director of Adopt an AED, and today I'm going to talk to you about how the body processes a vaccine potentially for COVID-19. There are several different approaches for potential vaccines against coronavirus. The basic idea is getting an injection with a mild version of the virus. Vaccines expose the body to a version of the virus that is too weak to cause an infection, but strong enough to stimulate an immune response. Within a few weeks, cells in the immune system would make markers called antibodies, which would be specific to the coronavirus or specifically its spike-like protein. Antibodies then attach to the virus and prevent it from attaching to human host cells. The immune system will then respond to signals from the antibodies by consuming them and destroying clumps of the virus. If you catch the real virus at a later stage, your body will recognize it and destroy it. Your immune system is effectively prepared and ready. This is exactly the same process your body uses when you have the flu injection every year. In order to help and prepare your immune system should you come into contact with the flu. This is exactly the same process your body uses when you have the flu injection every year. In order to help and prepare your immune system should you come into contact with the flu. Collecting evidence on whether this is possible, safe and effective is part of the reason as to why it's taken so much time to develop a vaccine by the researchers. There is a lot of information currently speculating whether we already have a known vaccine from Ebola or from other SARS viruses, but it's important to remember that the vaccines normally take a long time to develop. The Ebola vaccine, for example, took approximately 5 years to develop, whilst others take a lot longer. Researchers are literally working against the clock to find something that will help in this pandemic. Researchers hope to develop a vaccine for the coronavirus in a record-breaking 12 to 18 months. Every day we learn something new about the virus. For example, there have been several vaccines suggested for trial, including chloroquine or chloroquine combined with azithromycin. Another study suggests that the virus is capable of mutating around 100 times faster due to it being an RNA-based virus rather than a DNA-based virus. A little reassurance is that it mutates a little slower than influenza. The best way to stop this from happening is not to give it the opportunity to, while a vaccine is being found. All of this takes time, and whilst we would like to see a vaccine appear out of thin air, the reality of it is that we need to wait and support those working towards the greater good of everyone affected. Please, please, please stay at home if you can to protect the most vulnerable, and don't forget to wash your hands and keep good distances from others. Please click below on the links and don't forget to like, subscribe and share. If you have any questions, please feel free to check out our frequently asked questions, or alternatively, contact us directly at www.adoptanaed.co.uk, and we will be happy to assist any way we can. On behalf of Adopt an AED, adopt, register, respond.